Heidie Case.
Good afternoon, Chairman Berry, committee members, and commission. I'm here on behalf of SAGE Metro DC, an affiliate of SAGE USA, which is services and advocacy for gay, lesbian, bisexual, and transgender elders. We are a program of the Metro DC LGBT Community Center. Our mission is to provide support and advocacy for aging members of the LGBT population and those who provide service to them. I want to begin with a thank you to the DC Office of Aging for their ongoing commitment to members of our community and the assurance that appropriate services will be available and accessible. And I want to thank you, Chairman Berry, for taking on this important responsibility at this difficult time as chairperson of the City Council Committee on Aging and Community Affairs. As we all know, that with election changes come changes in personnel, and particularly after being here today, I feel assured that the openness and sensitivity to the needs of our community will continue to be addressed by the DC Office of Aging now and in the future. But for this assurance to be translated into reality, indeed for the continuity and advancement of all aspects of services to older DC residents, we urge you to do everything in your power to expedite the appointment of a permanent and highly qualified director of the DCOA. As Mr. Morrison eloquently said, we have not had the benefit of a comprehensive needs assessment since 1974. And in the long run, I'm sure we all know that good planning based on an assessment will save district time, money, and resources. We strongly urge you to direct the DC Office of Aging to implement plans to accomplish 3 important goals from their draft plan of 2011 through 2013. A goal of standardizing the collection and analyzing of data on the number of LGBT residents receiving services through the C-STARS collection plan by September 2013, convening a working group within the Senior Service Network to address these issues by September 2011, and establishing a volunteer peer advocacy group for older LGBT in continuing care residential facilities and nursing homes by September 2012. We must discuss the increasing age of persons with HIV/AIDS. First, the DCOA is to be commended for its collaboration and co-sponsorship of the June 2010 Washington, D.C. conference, HIV/AIDS Affects Us All. The DCOA draft plan stated that persons over 50 years old account for 1/3 of the over 15,000 people living with AIDS in D.C. The epidemic has moved to the general population of older persons, and 1/3 of the new cases of reported HIV are women. And while older individuals are at significant risk for HIV infection, they are almost
begin to wind down.
Yes, they're almost universally left out of prevention programs.
Thank you very, very much. I want to thank you for your testimony. You ought to know that Mayor Gray has appointed Dr. Pappas, who's an outstanding leader in the AIDS and HIV/AIDS field. So we are on our way to a new direction with Dr. Acker as the Health Commissioner, Department Head for the District of Columbia. In terms of SAGE Metro DC, what do you all do?
We are services and advocacy for the LGBT elder population. We support, we're part of the SAC, the Senior Advocacy Council. Okay. We work to make sure that services are LGBT friendly and welcoming.
Thank you very much.